So this is again, what is actually the public health? So it's like the obligation, all those things, to improve the quality of health for the public, improve the conditions, many things that the public is living. So it means, of course, even if you look like now when you are buying whatever product, nutritional product, the labels there. So how much of the sugar is there, carbohydrates and everything. So it's giving the information to the public that they can be involved, actively involved what they are consuming. Also like Clean Water Act to have like drinkable water. Public health infrastructure, doing the vaccinations and everything. So public health on its own, it's really, you know, taking care of the public to improve the quality of life. So what do you think? Do you like that picture? Oh, a lot of colors here. So if you look on that, it's just making you smile on your face. So I hope, I know that when you finish this class, maybe 1 hour or 2 hours, we will have your lunch. So I hope that you will try to pick up some kind of nice colors for your lunch that will cause the smile on your face. Actually, sharing another story with you, I have one patient that he was actually quite old. He was like 90 years old, and he just came for the lifestyle modification consultation just to check that, to be sure that everything what is doing in the right direction. And of course he was already 90, walking, you know, not having chronic diseases, so he was doing something right. And he was sharing information with me also that he is eating based on the colors, okay? So he always wants to have the 5, 6, 7 different colors a day. So it means like if you look on that, so it's representation of some type of vegetables, nuts, you know, everything what is from the plant origin. But what was quite interesting was when I was sharing a few years back in one of my class the information about it. It was in my nutrition class, and some students asked me, wow, we like that theory. So does it mean that we can have brownies because it's brown color? No, please don't do that, okay? So I just check if everybody's awake, it looks like, okay. So, very important thing, if somebody will wake you up in the middle of the night, you need to know the core functions of public health. Assessment, policy development, and assurance. So how you compare that with the medical system, medical care on its own. Assessment, it means like, it's almost like the diagnostic procedure. So if the patient is coming to the doctor, they try to find the diagnosis. So public health, it's doing the assessment. It's very easy if you can see that like on infectious diseases. You have the different tools, epidemiological tools or anything to find out what is the problem. Now, what needs to be done about policy development? Policy development is the treatment in the medical care or you know, recommendations and so on. And then assurance, so it means that we are really be sure that the public health policy, if this was established, it continues in the way. And so for example, if we know like tobacco is detrimental to the health, public health policy, you can see that on the door also, like how far you can do the smoking from that buildings. And assurance, like yes, it's the public is keeping that, following that, and with explanation. So you need to know the core functions in public health and how to compare with medical model. So this is something that I already shared that with you. Here is a little bit more described, but the basic information we just told you, that was the differences between public health approach and medical care approach. Many times when we think about public health, so of course it's on the public level, but also it can be on the individual level. Because if you do that individual level, then you are using the networking, and that one individual can talk about that and doing actually public health work and talking about that information. So now talking about the public health science and politics. So we need to have public health science. Some of you are as majors in public health science, so you need to find out, and you will see the different disciplines in public health, like epidemiology, helping you to find out the trend of the disease or to find out what is behind that infectious disease or the trend with the chronic diseases. So we need to have that. We need to have the public health policy. And unfortunately, many times it's also connected with the politics. When we talk about that position as the Surgeon General, a few years ago we have invited the Surgeon General was here and talking about the approach of Surgeon Generals. So they are always staying on the side of the public. So if there is something what is not that the politics should influence them, they are stepping out because their most important goal and mission is to prevent or keeping the health of the public. So this is very, very important to know also about it, and very important is for you also to know that the politics plays quite important role also in public health. We will go more about that later during the class, but just example is about the tobacco. So you will learn that back 1953 was already established. There is the connection between the influence of negative effects of tobacco in that time with lung cancer. Now we already know there are additional problems, cardiovascular disease, higher risk for occurrence of diabetes. But in that time, 1953, but it took time, many years, until 1980. That was actually established first smoking cessation classes and established that yes, we have to be aware about it and we have to do something about it. So you can see that big tobacco companies was playing a little bit politics a few years, maybe more than a few years about that before this establishment was done. So you have to be aware about that too. And this is the beauty on public health, because if some of you like challenges, so with the politics in public health, there are quite a lot of challenges, and that's the beauty on that. So you never have like, you know, that field and thinking like, oh, that would be the stereotype in my profession, public health. It's never stereotype. So public health disciplines, this is something that I mentioned to you that is very important to know about that also. If somebody will wake you up in the middle of the night, you need to know that. So it's epidemiology, statistics, biomedical science, environmental health, social and behavioral science, and health policy and management. So they are all important components. And of course, you as public health professionals, you will have the choices to be connected with any of that sections here. We will be talking about each of that specifically, so your actual textbook is divided based on that public health disciplines. But in general way, you need to know what is epidemiology doing, what is statistics doing, why we need to have statistics to collect the data in public health, why we need to have that, why we need to have that science. Of course, we would like to find out what is connected with the disease or what is under that under the disease, the agent causing that problem. So, and we need to develop the public health policy. So epidemiology, we will talk more about that, but generally it's the idea to find out, especially if we talk about acute diseases, infectious diseases, what is the agent, what is causing the problem, the disease. Statistics, the data. You need to have the data because you would like to compare the data. And maybe you will find out, well, there is the occurrence of the disease in Orange County, and you will compare that with the New York. What are the differences? Because if the data or statistics are different, you would like to find out what is the cause, what we can do, what kind of public health program we can develop. Biomedical science, we already talked about that. What do you think about this sentence? It is more important to know what sort of patient has a disease than what sort of disease a patient has. Do you agree with that? Yes? Yes? Why do you agree? Yeah?
Because by the lifestyle of the patient, you can connect the diseases instead of connecting the disease to the patient.
Yeah. So yeah, oh, you are amazing class. I love to be here. Yeah, this is great. Yes, of course. And this is also explaining another thing is, especially now that will be the season of the flu and cold, that there is the one person and maybe the person is running nose and having cold, and there are two people sitting, you know, one from one right side and one from the left side. And one person will get the cold and another person will not get the cold. Is it just the luck? I was lucky not to get the sickness. Or the person was keeping specific lifestyle, not just the protection, like not touching the face, with the hands and washing the hands, of course. That's probably very important part there also. But maybe eating the food, improving the immune system. Maybe having the antioxidants, anti-inflammatory, enough of hours of sleep, because with sleep you are increasing your immune system. So yeah, so this is almost telling me like, is it just the luck, or this is something that I was able to do about that? And again, you are going with this idea almost to that when I mentioned about the normal and typical aging. So this is something, showing me again, this is quite valid. If you look on that, that's the wisdom almost 100 years back. So why we don't continue in that? Why we are not, just telling public, please, this is so important, please follow that, message. So we need to do more about specific public health education and promotion. So environmental health sciences, we will have section about that. There also we will have the guest speakers talking about water, about the air, safe food and all of these things. So that's part of the public health. Social behavioral sciences, one of your classmates mentioned that, it's also very important. How to engage people, be involved in the process. How instead of passive consumer, we will get the active participant taking care of their own health. So how to do that? This is the work of public health providers.